My name is Dr. Philip Isherwood. I'm the Medical Director for AppleGate Recovery. I've been a physician for over 30 years. I'm currently boarded in family medicine and addiction medicine. I'm a retired colonel in the United States Army, and I've taken care of service members both here in the United States and overseas in Afghanistan and Iraq. I was one of the founders of AppleGate Recovery in 2008. We started seeing patients in 2009. About 2006, Suboxone or buprenorphine-containing medications started becoming more readily available and widely used. With that, it seemed to be a medication that could provide great benefits for patients. And we felt that there was an opportunity to have something much more patient-facing and patient-centered in terms of the treatment of the disease of addiction. The AppleGate Recovery Program focuses on the patient and the patient where they are at within their journey of recovery. There are many ways that somebody can wind up becoming addicted, but the most common is we see patients that have genetic predisposition for addiction, and really within their family there's almost generations of people that have either substance use disorder or behavioral addiction. Some common symptoms of opioid use disorder really have to do with cravings, and patients have intense cravings that they cannot mitigate or assuage. They also have great knowledge that the substance that they're using is causing them significant amount of harm. As patients start using more and more of these substances, frequently they start avoiding social work, family obligations. And of course, when patients start using these substances and acquiring them, they wind up putting themselves in incredible danger and risk, not only in obtaining but in using these drugs. Patients that have the disease of addiction typically realize they are using more of a substance than they intended to, and they're devoting far more time to it than they expected to be. At that point, they should try to seek help. In explaining about Suboxone or the buprenorphine combination medications, we're talking about a couple of different drugs. Suboxone is a combination of buprenorphine and naloxone. There's plain buprenorphine just by itself, which is referenced to as Subutex. There is also a long-acting injectable buprenorphine that is called Sublocade. All of these, the buprenorphine component, binds to receptors in the brains that are the same receptors that opioids bind to. These drugs collectively help reduce withdrawals, reduce cravings, and allow the patient to feel normal. Buprenorphine ingestion is done in a very specific way. Most important is realizing that buprenorphine only absorbs in the mouth. As such, we tell patients not to eat, drink, use any tobacco products for about 15 minutes prior to ingesting the buprenorphine. We tell them to put it under their tongue, and then after it's under their tongue to chin tuck, meaning place the chin next to the chest, or to look down at your shoes. The purpose of this is to allow the medication to dissolve in the mouth and to allow the saliva to pool in the mouth. After the medication is completely dissolved, I tell people to spit that medication out and not swallow it. In early 2022, the FDA, the Food and Drug Administration, had some additional guidelines. They recommend after the medication is no longer in the mouth to rinse your mouth out with water. You can either swallow that water or spit it out. The idea here is to help preserve your dental health. People choosing AppleGate Recovery can find an OBOT, an office-based opioid treatment program. When they come walking through our front door, it takes a great amount of courage and strength to do that. We hope they find a place of compassionate, respectful care in a comfortable environment. We have trained providers, counselors, supportive staff that help a patient along their journey of addiction recovery. An area that I'm very proud that we have capacity in is patients that are pregnant. And our focus there is on the mom and her unborn baby. And we realize that mom has the disease of addiction. so we want them to have as safe and healthy a pregnancy as possible. If you or someone you know is living with substance use disorder, visit AppleGateRecovery.com to learn more about our services and treatment options.